diploma, online only, visiting, mobility, which is study abroad, Langan-Parsons Consortium, graduate certificate program, ESL in design, ESL in music, and graduate and undergraduate degree program non-matriculating students. So as I said, all eligible students are automatically charged for the health fees. And then if you, depending on your status, you may be eligible to waive if you either don't want the coverage or you have your own coverage. So there are two separate health fees that are charged to a student's account. The first is the health services fee. A quick overview of the health services fee: it's $318 per semester, and basically it provides you access to the services at Student Health Services, which is the Student Health Center at 85th Avenue. We provide medical services, counseling services, and a variety of wellness and health promotion events and services. I, on the PowerPoint slide, did list a lot of the different services we provide. If you want a full list, you can go to the website. And then the health services fee also gives you access to the basic accident plan, which is underwritten by Aetna Student Health, and that's really $10,000 per occurrence for accidents only. So it's not comprehensive health insurance coverage. It's not going to help you if you're not feeling well or you need a prescription. It's just for accidental injury only, but that comes with the health services fee. The second fee is the health insurance fee. For the fall semester, it's $1,173, and it covers you from August 20th to January 14th. And then you're charged again in the spring semester when you register, and that fee covers January 15th through August 19th. So you're not covered just for the school year, you're covered the entire calendar year. Technically it's not the calendar year, but for an entire year. So August 20th of this year to August 19th of next year, so even through the summer. Basically, the health insurance is coverage that provides for the payment of benefits as a result of sickness or injury. So the Aetna Student Health Insurance Accident and Sickness Plan covers routine care, accidents, and illnesses. So I'll go over a few of the benefits, but if you want a complete list of the benefits and also the things that are not covered, you can find it on Aetna's website, which is aetnastudenthealth.com. Or you can go to the New Schools website and download the Aetna plan brochure for the 14-15 school year. So we get a lot of questions about who is eligible to waive. So as far as undergraduate students, students that are registered for 6 or more credits are required to pay the health services fee and are eligible to waive the health insurance fee if they have comparable coverage. So undergraduate students registered for 6 or more credits must have insurance coverage, and they don't have to have our plan. If they have their own, they can waive our plan. Undergraduate students registered for 5 or fewer credits are eligible to waive both fees, and all grad students are eligible to waive both fees. So there are a few things to think about. If you want to pay the health services fee and have access to the services at Student Health Services, you can waive the health insurance fee, but then you must have your own insurance coverage. Basically, all students who will be seen at health services need to have insurance coverage, whether it be our coverage or your own coverage. You have to have some sort of insurance coverage, so you can't waive just the insurance fee and keep health services. And then for international students, we don't require proof of insurance coverage to waive both fees. However, if you need to have health insurance because of your visa, then that's something to think about. If you could technically waive both the insurance fee and the health services fee, but if you're required to have insurance for your visa, then you need to make sure you have your own personal insurance coverage that will cover you while you're here. If you want to waive the health fees, then you'd go to universityhealthplans.com and click on the local link, and you need to submit that waiver before September 22nd, 2014. So there are a lot of questions about what the plan covers, but I think first it's important to talk about some terms that come up a lot. Preferred provider, which is also known as in-network provider. These are providers that basically have a contract with the insurance company, and they have negotiated a discount with the insurance company. A non-preferred provider is a provider that does not have a contract, and they're considered non-participants. This is important because with the Aetna plan, your coverage is different based on if you see someone in-network or out-of-network. So you're going to pay less out-of-pocket if you see an in-network provider, also called preferred. A deductible is the amount a member will pay out-of-pocket before the insurance company will make payment towards any covered healthcare costs. So with the Aetna plan, the yearly deductible is $100. So basically, before the insurance will pay any amount towards any claim, the first $100 is your responsibility, and then your co-insurance goes into place. Co-insurance is a percentage of a covered service that a member is responsible for. So with our plan, if you see a provider that's in-network, then Aetna will pay 90% and you would be responsible for 10%. If you see a provider that's out-of-network, Aetna would pay 60% and you'd be responsible for 40% plus a $25 copay. So the plan gives you the freedom to see providers of your choosing, but it's definitely more cost effective for you to see someone that's in-network because you'll pay less out-of-pocket that way. And then some plans have a benefit maximum where the plan will only cover up to a certain amount and then stop paying. And our plan does not have that. Our plan has unlimited coverage. And I want to clarify that when I'm talking about our plan, I'm always talking about Plan 2. There's Plan 1 and Plan 2. Plan 1 is the health services fee and that basic accident plan, and Plan 2 is the comprehensive insurance plan, and that's what I'm referring to as Plan 2. So I did a little overview of different types of visits and what the coverage is. It's pretty much always 90% if you see someone in network, 60% if you see someone out of network, except for emergency room visits. With emergency room, it doesn't matter if the hospital is in or out of network, it's still covered at 90%. So you don't have to worry about where you're going in the event of an emergency. The plan also covers mental health benefits, and it's also covered at 90/60. If you have not received your insurance information, it could be for a couple reasons. So Aetna has already sent out insurance cards. If you haven't gotten one in the mail, it may be because your address isn't updated. They don't send cards internationally, so you want to make sure that you update your My New School account with your local address. You want to update your official mailing address. And once you do that, you can request a card from Aetna. Or you can print an insurance card from their website. You just go to aetnastudenthealth.com and search for the new school and then click on Print ID Card. The Aetna plan partners with On Call International to provide travel benefits. So I won't go into detail about this, but I did list the different benefits that are covered under the travel plan, and you would just want to coordinate that with On Call International. So if you have a trip coming up and you're curious about what your coverage will be, you can call them and it can give you more information. And I just want to point out that if you use your insurance out of the country, you still have coverage because the coverage is worldwide. However, it's going to be considered out-of-network benefits because you're not going to find preferred providers in different countries. So most likely, you'll have to pay at the time of service and then get a receipt and submit it to Aetna, so they'll reimburse you based on your out-of-network benefits. If you don't know how to find a preferred provider, you can either ask Student Health Services for our referral list. We have compiled a list of providers in the area that we know and trust and refer students to all the time. So if you're looking for a specific type of doctor and you want to find someone in network with Aetna, you can ask us for our referral list. Or you can go to Aetna's website, and they have something called DocFind, where you can search by location or by specialty and find someone in your area. So in an emergency, you should call 911 and an ambulance will transport you to the emergency room. Make sure you have your insurance card with you. We also have a 24-hour nurse advice line, so if you're in a situation where you're not really sure if you need immediate medical attention, you can either call Student Health Services while we're open, or if it's after hours, you can still call the main number, and you'll be transferred to the nurse line, where a real live nurse will pick up the phone and advise you what to do. So you can tell them what your symptoms are, and they'll tell you, well, you really need treatment right away, or this can wait till tomorrow, call Health Services when you get up. And we will also get a record of that call, so we'll follow up with you the next day as well. Just a prescription overview. If you need a prescription for a medication, a doctor will either give you a prescription slip or they will send it electronically to the pharmacy. And so you'll go to the pharmacy, you'll need to present your insurance information, and then you'll have a copay. And the copay will depend on the type of medication it is. And I've outlined for generic medications, it's $25. For a preferred brand name medication, it's $40, and a non-preferred, it's $50. And it's impossible to give you a list of which medications are preferred or preferred, but that is something that's available on Aetna's website, and most providers will be able to have access to that information, and they'll know that before they give you the script, so you'll kind of have an idea of how much it should cost. So things that you should probably know before you use your insurance is take the time to read the plan brochure. It's available on our website. It lists everything that's covered and everything that's not. So I think, it's worth spending a few minutes just to go through that brochure, and then you can always ask us if you have any questions. You can stop into health services, or you can call us, email us. Make sure you present your insurance card when you're visiting a medical provider. Make sure you confirm that the provider is in-network. If you are being treated by an in-network provider, they're going to submit the claim to the insurance company automatically. However, if you see someone that's out of network, there are a couple of different things that could happen. You might have to pay at the time of service and submit the claim on your own, or you may have to pay at the time of service and they'll submit the claim for you. So you kind of want to ask how it's going to work. Ask them what their process is. And then if you ever need to be admitted into the hospital for a procedure, like where you're going to stay overnight, then you do have to contact Aetna and let them know. It's basically called pre-certification. So you're letting them know ahead of time that you're going to be admitted, and then they give permission to the provider to see you and to pay the claim. If it's an emergency, you don't have to let them know ahead of time, but once you are there, most of the time the provider will do that for you. They'll call and get pre-certification, but you just want to make sure that you're asking if that's happened, because you're the one that gets penalized if your provider doesn't do that. So if you're ever in a situation where you're going to spend the night at the hospital, just make sure that they've gotten this pre-certification so you don't get, it's a $200 penalty, which basically means $200 of that visit won't be paid. So it's really important to do that. So we've gotten a lot of questions about dependents. I believe it was last school year was the first school year where dependents were eligible to join the plan. However, since they're not students, it's the process of enrolling them is a little bit different. Students are automatically charged through their student account. With dependents, they have to fill out, well, you would have to fill out a form for your dependent and then send the premium, the payment, directly to University Health Plans, which is our insurance broker, and they will enroll the student on their own. It's not done through the new school insurance office. So I just want to go over a couple things regarding the Affordable Care Act. So under the Affordable Care Act, students may be eligible for a subsidized insurance plan via the government-run insurance exchange, and residents may enroll only in plans within his or her state. So there are a few things that may make it not so attractive to students. A lot of the plans are high deductible plans, which means that basically, like some of the plans, for instance, have like maybe a $6,000 deductible. So that means the first $6,000 you use, it's not covered. You have to pay that out of pocket in addition to the premium that you're paying monthly for the plan. Some of the plans include high out-of-pocket costs. There may not be a large provider network. And also, if you apply in the state you're from, then you may not be covered in another state. So you may not be covered in New York, only within the state that you applied. So generally, international students are not eligible for the subsidized marketplace plans because you have to prove permanent residency or intent to reside. Do you want me to go over some more information about Affordable Care Act, or was the question mainly if international students are eligible? So I just included a chart that's kind of hard to read on the small slide, but it compares the new schools plan to the plans that are offered on the marketplace. However, it doesn't include the prices that it would be if, let's say, you were eligible for a tax credit. So there are things that could make it cheaper for you and more affordable for you if you are eligible for one of the plans. But this is just kind of a breakdown of the coverage in comparison to the new schools plan. And then I also included some contact information, Aetna's information, On Call International if you're planning to travel, as well as information about student health services and how to contact us. So, any questions?
I have just a simple question. Thank you very much for that. I'd assume, even when I travel back to my home country, while I'm a student here, I'd still be covered by the Aetna travel insurance, such that even when home, I can then claim. I'm still eligible for the benefit even when I'm at home.
That's right. Yeah, so if you're registered for that semester, but you, let's say, travel back just for a few weeks, or maybe it's the summer and you're back for a few months, if you're seen there, you would want to make sure you keep a receipt of everything that was done and what you paid, and then you'd be able to submit it as a claim to Aetna. So you would come back, we can give you instructions on how to do that, but it's basically submitting the receipt, putting on there that you're a new school student with your student ID number, and then it would be processed according to your out-of-network benefits. And the check would be sent directly to you since you already paid upfront for the services. Yes.
Is there a preferred pharmacy, or does it matter what?
There are, however, Aetna has a huge network, so most of the pharmacies you'll find are in network with Aetna. It's always good to check and just make sure, but I haven't really found many, especially all the big name ones like CVS and Dwayne Reed and all of those. Most of them are in network with Aetna.
So if I say that my preferred pharmacy is, for example, Walgreens near my house, can I go get my drug in another Walgreens, or I should take it from that?
It depends on their policy. Sometimes they'll transfer a prescription for you, but some of them require that you choose a home pharmacy and just pick up your prescription there. But you should just check and see what their policy is, because I've had that happen before. Even people who've been out of state, sometimes depending on what the medication is. Some medications cannot be transferred over state lines, but some can.
So, okay, if I want to pay the health service fee, here you say that, okay, I can waive also the health insurance fee, but I must provide a proof of alternative insurance coverage, right?
Right.
Can I provide that proof with a health insurance abroad? I mean, not from U.S.?
As long as it provides coverage for you while you're here.
Okay.
So if it were, let's say it was just emergencies only or something, you really wouldn't be able, that wouldn't be a comparable insurance. But if it provides coverage for you while you're studying here, then yes, you could waive our plan and use that as your alternative insurance, and then also receive it health services.
Mm-hmm. And who evaluates that, I mean, that international health insurance? Who is able to say, yes, this insurance actually...
It's really the student's responsibility. When you fill out the waiver form, you're putting in your insurance information, and then you're basically saying that you understand that this coverage needs to be comparable, and then if something isn't covered, that your medical costs would be your responsibility. We're not going to call and check your insurance. We trust the students. So you would just put it on the insurance waiver form, and that's providing proof.
Okay.
Do you happen to know anything about, like, if international people can be eligible soon or in the near future to Obamacare or anything like that?
I don't know. I don't think so, because you would have to prove residency. So I haven't heard anything about it being expanded to international students, but definitely if that were to
Announce.
communicate that.
All right.
Mm.